Hi, I'm Dr. Sunny Nakae, and this is Interviewing Skills. I'm going to provide just a quick guide for the things that you need to know when you're interviewing for medical school. Important is interviewing and getting accepted to medical school. Really important. All medical schools do interviews as part of their admissions process, and so you really need to make sure that you are well prepared and that you know what you're getting into before you start. For the interview, you need to understand what information the interviewers will have. So what do they have that's been part of your file that you've submitted? You need to understand the school and yourself, and what's the relationship between these two things. So why did you choose to apply to the school? What's important to you about attending? What are your goals in medicine? And these things should relate to your application strategy. So there's an open file format where they have everything that you've submitted, your letters of recommendation, your secondary application, your AMCAS application, transcripts, test scores, everything. There's a blind interview where they just know who you are and they don't actually have any information that you've submitted in your file. And then some schools do something that's called a partial file where they maybe will include a personal statement or everything except letters of recommendation or everything except transcripts. So there are different versions of the information that interviewers will be given depending on the format. And then the interview formats could be multiple mini interviews, different versions of panel interviews, or the traditional one-on-one interview. So you will rotate through a series of stations in a multiple mini interview, and you basically do the circuit, and all the applicants do the same circuits, but just in a different order. So they're timed and kind of choreographed, and as you rotate through, each applicant has a different scenario with a different interviewer across all of those stations. So it ends up being goes by really quickly, but you visit each station and it gives a very clear view of each applicant with every interviewer across every scenario that's given. So there are prepared scenarios, usually one room for each one. Virtually, this is a little bit different where we probably will go into a breakout room or have something a little bit different. While you're doing the scenario, you usually have a copy of it and can see it. It's a timed interface, so once the time is up, you have to rotate to the next section. You'll just get kicked out of the room because somebody's coming in right behind you. And then each of the raters will score their applicants using a numeric scale. There are lots of ways to do the scenarios. Obviously, in the time of COVID, it's a little different where most of them are going to be not necessarily role play or maybe a little bit different. If there's an actor, it might be kind of a different scenario, but it might be doing something with an actor or standardized patient. There could be something where you're doing some teamwork exercise with another interviewer or another actor in the room. There could also be discussion-based scenarios like an ethical dilemma or what would you do, or just a traditional type question, but in an MMI format. The MMI are aimed at kind of minimizing individual bias. So more structure, which means kind of more fairness and more validity for the ratings. It's definitely open-ended, so there's no right or wrong answer that you're supposed to come up with. It's not supposed to be that you need prior knowledge, prior medical knowledge or specific knowledge about research techniques or certain topics to be successful. The assessment is quantitative in nature and then sort of averaged or z-scored across the stations. So if some raters are hard graders and some are easier, a z-score has a way of accounting for that across multiple observations. And then these are also very school specific. So schools can choose scenarios or examples that fit their mission in really important ways. So next up we have panel interviews. So this could be any combination of more than one interviewer and more than one student. It could be multiple interviewers with just one student. There could be 2 and 2, various combinations. Basically, it's meant to give multiple views of an applicant. Typically, there'll be a series of questions with the same people. So rather than rotate through different people and different questions, it's a set of questions usually with the same group. This can be a benefit because there could be more discussion. There could be more kind of back and forth or group problem solving or like sort of you're all stuck on a desert island kind of scenarios. And it does allow applicants to show how they build rapport over time and with more than one person rather than just individually. So maybe one panelist, you don't really hit it off with them so well, but another panelist you really like. One scenario question you don't do that great on, the panelists are able to see that with another scenario or another question you do better. So it does provide a little bit of a view over time to do a panel format. Traditional one-on-one interviews. These are highly personal. You're going to be kind of face-to-face, sitting across from someone. It's an opportunity to exchange ideas and really explore your fit for the institution, maybe a little bit more in-depth than you would get to in other types of interview formats. These are going to be heavily focused on you, obviously, to talk for 35, 40 minutes. The subject is you, and sort of why you want to go to that medical school, why you want to be a physician, talking about your learning experiences from the things that you've listed on your application as, formative things or growth experiences or accomplishments. Preparing for the interview. So you need to know where the interview is. That seems kind of basic, but you'd be surprised how many people get lost on their interview day. This is a little bit less likely in the time of COVID, but this means that you should check your link and make sure that it works, that there wasn't a digit or a number left off of it. Make sure that you have the software downloaded properly. If the first time you're clicking the software to get in is 5 minutes before it's supposed to start, and now you need to download something, and now you need to restart your computer, make sure that you get everything worked out with the link in advance. Know and learn your calming reflex triggers. It's really important to be able to sort of access that deep breathing or a happy thought or something that can really help you focus and stay calm during the interview. And then, of course, on camera, even more important is to sort of manage your face, right? My favorite advice from one of my earliest career mentors is to really be aware of what you look like. So talk to yourself in the mirror if that means understanding what you look like when you say things, or that you're talking with your hands a little bit too much and they're going off screen. Make sure that you are aware of what your expressions look like when you're on camera. I want to anticipate questions, and I have some, in the rest of this presentation, but you want to be able to think about, based on what I know about the school and what's important to the school, what types of things do I think that they're going to ask me? Practice responding, but do not rehearse. So the difference being, ask yourself a question and then practice responding to it. Ask the question in a different way. Force yourself to give an example or to tell a story about an experience. Practice describing and talking about the meaning making from your experiences and answering those questions fluently. Do not memorize responses to questions. Memorization typically shows through on the other side. So when I'm interviewing someone, if they sound very rehearsed, it's probably because they spent a lot of time rehearsing exactly what they wanted to say. And then thirdly, dress the part. So wear your entire suit. It will make you feel more official and more prepared for that event, and you'll be more confident and really ready to roll if you practice in your suit and prepare. Review your application and the supplemental materials that you submitted. Remember the things that you said and the things that you claimed, particularly if it's an open file interview. This is going to make up maybe some of the content of what you're going to be asked. You definitely want to know the school's mission and focus on that, and think about yourself and how does the school's mission line up with your mission. Making sure that you communicate that in an interview is one of the most important things that you can do. And then finally, think about the stories and experiences that best describe your strengths. Things about working across difference or cultural strengths, language skills, management skills, leadership, all of the great qualities that you bring. What are the experiences that illustrate those qualities that could be used as sort of bullets or pointers that you might be able to respond to questions giving examples of your experiences? Again, dressing the part. Don't let your clothes say more about you than you have to say for yourself. So we don't need flashy things. We don't need extra bright colors. If you have a fidget temptation, like a ring that you twist or a necklace that you fidget, if you have, something that you like to click or tap, please remove your fidget temptations. If you need to fidget, do so quietly and off camera, especially if it's a video interview. Simple hair, makeup, accessories, nothing really wild. And of course, in the era of COVID, a simple background. So make sure that you don't have a lot of distracting things happening behind you. Even if you need to hang up a sheet, get a couple of clothespins or use some duct tape and tape a sheet to the wall to sort of clean up your background, please do so, because you want the focus to be on you, your communication skills, and your messages while you're doing this. On the day of the interview, you want to warm up. So you don't want to roll out of bed and not utter a word to anyone and then go cold onto the interview. I did a voice recording to correct some of our graduation announcement names. And on the day of graduation, my voice had a very different pitch than when I woke up on Sunday morning and saw the email from our media person asking me to re-record some of the names because like the cheering from the families was so loud that some of the names we couldn't really hear clearly. So in the final version for YouTube, I get up and I start recording. And I think my voice was like an entire octave lower because I had just woken up in the morning and I wasn't as enthusiastic or potentially as like amped or nervous as I was on graduation ceremony day. So I got this email back from Ross, like sending me the two files side by side. And I thought, oh my gosh, that's what I sound like when I'm not really warmed up. So you definitely want to warm up your mind, read something, review your application a little bit, talk, warm up your voice. If you like to sing or hum, and also do some movement, stretch your body and get relaxed. If you feel a lot of tension building, do some deep breathing and make sure that you're really ready to perform. Body language is really important across, especially on video platforms. So in person, it's not likely to happen this season, but when we do have in-person interviews, you want to have a firm handshake, making eye contact. If you sit upright and lean slightly forward, that's helpful. You want your hands to be relaxed while you're interviewing, not super gripped or tense. If you talk with your hands like me, make sure that they're under control and that you're not gesturing, like I said, way off camera. And then your facial expressions should be pleasant. You want to smile. You don't want to look like you're in pain or you're worried about something. People are really going to be focusing much more on your face, given the limited scope of view that we have in Zoom or online interviews this season. The goal of this whole thing is communication, to learn about the school and to also share about yourself. So be assertive in speaking up if something goes wrong. Confirm that people can hear you. It's okay to ask, can you hear me? Is our connection okay? Speak up and notify if something goes wrong. If you lose your connection, be an advocate for yourself, but keep calm and understand that the school is going to do everything to make sure that you have a fair and equitable interview process. The school understands that these types of things happen. We are in meetings all the time and people's Wi-Fi goes out, someone just disappears. We're building in a lot of contingencies into our video interviewing process for this, to account for this, but we definitely need you to stay calm and be a problem solver and also advocate for yourself if something goes wrong. We make a lot of assumptions based on individuals' voices. If you're talking really quietly and people just can't hear you, they're going to make a lot of assumptions about your demeanor, or your leadership skills, or your level of assertiveness, or self-advocacy, or self-esteem. That said, if you're yelling and you're using a coaching voice all the time and you're interrupting people, they're going to assume maybe arrogance or overconfidence or that you're overbearing, your social skills aren't up to par. So same with interjections or your gaze, always looking up or looking down. Staring dead on can be very unnerving, especially on video interviews, but also avoiding eye contact or like constantly just showing us the side of your face might not be something to work on. So there is a practice Zoom room. If you just Google practice Zoom room, you can log in and you can see what you look like in a Zoom type interface and play around with it. You can be in there as long as you want. It just works to show you what your background would look like. The lighting, I think it's important to also check those things out. And just if you're nervous about any of these things, then practice or just set up a video chat with a friend and ask for their feedback. Am I speaking clearly? Do you hear me? Am I too loud or too quiet? How's my eye contact during the conversation? Are stuttering or stammering, if you're shaking or doing something that's causing the screen to wiggle because you're wiggling your leg and it's wiggling the desk, if you are touching the other person, which you're not likely to be doing because these are mostly going to be video interviews this season. But again, really pay attention to how you're coming across on screen as much as you would if you were there in person. I really like to encourage students not to fall into the trap of giving a one-word answer or giving a simple reply. You are not there to face a firing squad and to sort of get through it. You are there to explore and share and present yourself to the committee. And the interview is one way that you're going to do that. So even if the question is phrased, really poorly, do expand and use that as an opportunity to share your ideas and talk about yourself, your passions, your motivations. You make sure that the interviewer knows your story. Overthink the questions, particularly as the introductions go through. It's always funny to see applicants really try to sort of posture, maybe we'll go around and do an icebreaker and say, tell us your name and sort of what you're watching lately or what you're listening to. And people will say like, oh, I'm watching like the C-SPAN briefings of like Dr. Fauci or, I'm trying to, read every article in academic medicine that comes out this month. Maybe that's true, but just be genuine and be yourself, and don't overthink it. Obviously, you want to be honest, you want to give a professional answer and find the happy medium between the two, but especially on like icebreaker opening questions, you want to just relax and be yourself. Questions that are going to get at your values, and these are about assessing fit and whether your experiences have lent you the preparation and insights to be a good fit at the institution. So values questions will be presented in, do you think medicine's a right or a privilege, right? That's exploring your values around medicine, who you think is deserving of medicine. Do you understand healthcare disparities? How much have your experiences taught you about what the downstream implications of healthcare disparities are? And then, thinking about inequality or racism or current events. These could be ways that the school is really trying to explore your fit for the mission of the institution. Character questions that will talk about growth or resilience or teamwork or leadership or disappointment, or what something means to you. And these are really meant to probe, again, like aspects of your maturity and your viewpoint. What did you gain from your experiences, and sort of what level of meaning making have you engaged in your preparation process? Next level answers. So what I mean by next level answer is to give an answer that nobody else could give. So make your answer unique. That's how to make it memorable. That's how to make yourself further stand out. Obviously, you've done a great job of standing out or demonstrating that you're mission fit because you have an interview. But if you can talk about growth and reflect on your experiences, that will allow you to capture more of the essence of your experience. So let me just give you an example. So pretend like you're asked to talk about a time that you demonstrated leadership. You could just say, yeah, I organized Relay for Life and we raised $10,000 and it was really great, and I organized everyone and I delegated and everything was super great. Or you could take it to the next level and you could say, what I learned about myself in going through some of these leadership exercises was that it's okay to make mistakes. Share some reflection and some growth from that. Or what I learned about this is it's important to have compassion. Like when folks fall short, we all need someone to be encouraging and understanding. Where's the line between accountability of the work getting done, especially if we're being held accountable by the administration or by the community, but also making sure that we are compassionate and caring for each other in the process, right? So you could share insights and growth and things beyond just, yes, we accomplished this goal and I did all this, leadery, organizationally kind of things. And that way it would be an answer that one is not generic, but also is specific to you. So next level. So you want to demonstrate critical thinking and maturity and empathy. And again, like if you do the next level answers in an interview process, even if it's in a multiple minute interview where you might draw in some personal examples that inform how you would handle or what your logic is about how you would handle a scenario that you're presented with. This shows us that you've learned from it. It shows us growth. It makes who you are on paper really come alive, and again, helps you stand out to the committee. During the interview, it's important to relax. I think I've said that like 10 times, but it is important. You want to listen carefully to the question and take some time developing your answer. If you need to write a little notes on some scratch paper, be sure that you answer the entire question if it's a multi-part question. Use humor with extreme caution. It's very hard to convey something that's funny when you've just met someone. You don't have enough of a shared context. What one person thinks is really funny, another person might not, or it just might not come across, and then there'll be sort of an awkwardness. So really be caution about, or use caution when it comes to humor. And then you want to speak clearly and at a good pace, not too slow and not too fast. Pay attention to listener cues, especially over video interviews. Is the person leaning forward? Are they looking confused? Can they hear you? Are they looking bored? Are they looking off camera? Right? Maybe you need to wrap it up if the person's starting to look disengaged, or if they're continuing to ask you more questions, maybe this is going well and you should just roll with the conversation, right? So really not just answer the question. Don't be so caught up in answering the question that you're not paying attention to the listener cues and the communication elements that we're also assessing in the interview. mentioning your academic record or test scores, good or bad, again, whatever they have about you, they already know, or they don't know for a reason because it's supposed to be a blind interview. So if you're talking about things that are good, well, by the way, my test scores are so beautiful, blah, 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 it's going to seem like you're compensating for other areas. But if you're going to mention them because you feel like they're bad or you want to be apologetic, then it's going to seem like you're not very confident. So it's best not to mention those things unless you're asked. If you do have things in your academic history that you anticipate having questions about, practice answering questions about those things. Yeah, organic chemistry was rough for me the first time through, and here's how I tackled it the second time around, or this is what I did differently, this is what I learned about myself and how I've grown academically. Be very careful about putting down other people or groups or institutions. One thing that we do not appreciate, as deep as our school pride runs, is for applicants to bash other institutions. If you, oh yeah, I interviewed at school Z last week and they were terrible and blah, blah, blah. We expect you to be professional and compassionate as we are with our colleagues, and we know that that could just easily be us the following week if we make mistakes in our process or someone doesn't have the best experience with us. And then, of course, do not be rude or inconsiderate to anyone, no matter how frustrating it is with either tech issues or what's happening on interview day. You're really representing yourself, not just today, but in the future of your professional career. And so you really need to be thoughtful and professional in your interactions. So for MMI tips, a couple of things. Read the scenario carefully and make sure you understand it. If you have questions or you need clarification about the scenario, then when the minutes are up, the read minutes are up, be sure and ask your clarifying questions up front. Create some notes or an outline about what you want to address and kind of try to offer your answer in an organized and logical fashion. Consider personal experiences that are relevant, like I said, so do that next level deep dive of your experiences that help inform your thinking around how you would answer a scenario. And connect your responses to your core beliefs and values when possible. And that will actually create, again, a level of depth and a level of sophistication to your practice questions to consider. These are typical ones that you're probably going to be getting at some point across the interview trail. These are good ones to think about and practice in front of a mirror, or to do your own mock interview with a friend or family member, or better yet, even with someone that you don't know. So if a friend of a friend is willing to do a mock interview for you, I would say go for these questions that you might be receiving. What would you do if you couldn't do medicine? Lots of questions about current affairs or things that are happening in the world around us. Again, some more practice questions that you could use in order to do a mock interview for yourself, thinking about describing the day in the life of a physician, or questions around structural determinants of health, healthcare disparities, most meaningful experiences, etc. You're asked if you have any questions. It's always great to prepare some. It shows that you are inquisitive and engaged and interested in the school. You can always ask sort of why the person chose to be part of the school, whether they're a student or a faculty member or a staff member. What's the best thing about this institution or XYZ program at the institution? What would you change about the school if you had a magic wand? It's even better to brainstorm specific questions. When I get really specific questions about UCR, like, can I choose the specialty that I'm going to be at for my LACE placement? Or if I want to do a PIP project and apply for funding for my PIP project, is that allowed? I really like it when students have explored in depth what they would look like, what it would look like for them to pursue their education at my institution. Interviewer, of course, say thank you. There's probably going to be no more shaking hands, but maybe an elbow bump or an expression of your gratitude. Do not ask if you thought it went well, or when you're going, what are my chances of getting in, and yada yada. Thank you notes, if you are genuinely inclined to write them, feel free. Obviously, different schools have different policies about correspondence with interviewers or folks from the interview committee, whether they go directly to the admissions office and are forwarded or not. And I always like to say, regardless of the outcome, this is an opportunity to build your network. So I have interviewed, done one-on-one interviews with applicants and just absolutely loved them. And at the end of the day, they didn't choose to come to my school, but I kept in touch with them because we had a lot in common, and I wanted to know what their goals were and how far they were going in medicine, just follow their careers. So it's great to be able to think about this as an opportunity to build your network, and again, have that connection mindset rather than I'm up in front of a firing squad and I just want to get through this and get in. This is really day one of your professional career. I want to wish you good luck this season. You can reach me at premedprepadvice@gmail.com, where you get information about my book and my monthly pre-med chats. And I hope that you all have a great season. Stay safe out there, and we wish you well. Bye-bye.